Medicare Fortune Firm here again. This is Zach Perry. We've got a special guest star today, Colby Baker. They call him One Take Baker, but I ruined that because this is our second take now because I started laughing. But anyway, we've got Colby Baker here. Colby Baker is an expert on Medicare, and so we're going to pick his brain a little bit because Medicare, I think there are a lot of misconceptions about what it is, where it applies, et cetera.
Oh, yes.
And so we want to just, like everything else, we're trying to peel back the curtain and show the way things really are and help people understand the way money and finance and insurance works. So
absolutely,
we're going to borrow from your wisdom for the next few minutes. And I may not know the right questions to ask, so if I ask a bad question, you pretend like it's good and then you answer the question I should have asked.
Sure.
Okay?
Yeah.
So tell us, what are some of the misconceptions or misunderstandings people have about Medicare?
Well, I would say the first thing that people don't really understand about Medicare is when you get it. A lot of people think that Medicare
when you turn
is like
18, right?
Well, yeah. Well, so I've been doing Medicare for 12 years, so I know Medicare like the back of my hand.
Okay.
Oh, that's new. No, anyway, yeah. So with Medicare, everybody thinks it's like Social Security, right? That you get Social Security when you're 62. So I'll be talking to people that say I should be starting Medicare soon. Well, how old are you? I'm 62 or 61, and I go, oh, you've got a few more years.
So when does it start?
65.
Okay.
So usually you can start collecting Social Security when you're 62. Maybe you can push it out to 67, and that might get pushed further back, and as far as what they decide to do with Social Security and all of that. It just depends. But Medicare has always been when you turn 65. And you actually have 3 months before you turn 65, the month that you do turn 65, and then 3 months after you turn 65 to actually enroll in what's called
64 3/4 to 65 1/4 years old.
Basically,
okay.
Yes, yeah. Very succinct analogy summary there.
So I'm 41 and 5/8, so
you don't qualify just yet.
Okay.
Okay. But you can also qualify for Medicare through disability. So I have plenty of clients that are in their 20s, in their 30s, that they just qualify for Medicare because through disability. Now, you might be thinking to yourself right now, I'm fully disabled. Why don't I have Medicare? Well, usually you have to have a full determination of disability.
I was just thinking that.
And then, it's usually a 2-year waiting period until you get Medicare, until it starts for you. So that's the biggest misconception is, when does Medicare actually start?
Okay, well that's good to know. I didn't know either of those things.
Oh, sure, yeah.
That's why we have you here. All right, and so what are some of the if someone is in a situation where they might, or either now or soon, qualify, what are some of the things they should be planning on or looking out for or doing?
So the first thing that you should do is, there's 2 parts to Medicare. There's Part A and there's Part B. Now, Part A is your hospital insurance, and that covers basically a room and a bed in a hospital. There's some deductibles there, but just bare bones of it, Part A is your hospital insurance. Part B is your medical insurance. So that's going to cover the doctors, the MRIs, the specialists, the blood work, the surgeries, all of that is covered under the ibuprofen that they give you when you're admitted in the hospital, right? That is covered under Part B. Now, Part A, you've been paying your whole working life for that, right? It comes out of that Medicare tax on your check stub. That goes to pay for Part A. So when you turn 65, you don't pay any more for that. Part B has a premium. And so a lot of people don't know that, when I turn 65, I'll just be on Medicare and it's all good. Well, no. You paid for Part A your whole working life, and then when you turn 65, now you start paying for Part B. And that comes out as a deduction from your Social Security check, and that can change from year to year. Usually every January 1, the government comes out with what the new Medicare Part B premium is going to be, deducted from your Social Security check before you even get it. This year, 2020, it's $144. Comes out of your monthly. Comes out of your Social Security check. And so if you're not watching your statements, you don't even know you're paying it, right? So a lot of people are not aware of that. There are programs too for the usually low-income programs that help people get that Part B premium paid. And the only way you're going to know that is if you talk to an agent like me that knows about those programs and that can help you figure out where to go for that. Usually you call Social Security, but this is the other confusing thing, is that Medicare is its own agency, right? Or not agency, entity, right? It's called CMS, or the Centers for Medicare and Medicaid Services. It's a federal program. And then you've got Social Security, which is another individual entity, but they talk to each other. And so the only way you know that you're going to get that Part A and B mailed to you, that card mailed to you without you having to enroll in it, is if you are receiving a Social Security check. That means you're already in the system and they're going to send you that Medicare card.
But there's a possibility that you hit 65, you want Medicare, but you're not taking your Social Security yet.
Yes.
So
and you might be thinking, I should be getting my Medicare card anytime soon. I have tons of clients that have this issue where they say, why hasn't my Medicare card come? And well, are you receiving a Social Security check? No. Okay, so you're not in the system now. You actually have to go down to the Social Security office and fill out an application saying you want your Part B to start at such and such a time. It usually will start the day one of the month that you were born, the year that you turned 65. But let's say you delay that for some reason. Maybe you have employer coverage because you're not retiring until 67. So you keep your employer plan going, and then now you're 67, you call somebody like me up and you say, hey, I'm dropping my group coverage. How do I get my Medicare started? How does this all work? And so the first question I would ask you is, do you have Medicare Part A and Part B? You might have a card. You might pull out a card that says Medicare Part A only. You may not have any card. My job then would be to tell you, you need to call Social Security. You need to get set up with your Part B, fill it out, and do it. Now, here's the other part. If you're not receiving a Social Security check and you want your Part A and B started, there's no Social Security check for them to deduct it from.
So how do you pay for it?
They're going to send you a bill, but they're not going to send you a bill monthly. They're going to send you a bill quarterly. So you'll pay 3 months at a time, which might shock some people because it's a $400 and some odd dollar
bill.
Yeah, $500 bill, and they're like, what is this? And it can really offend some people, but that's the way that they do it if you're not receiving a Social Security check.
I get offended when I get bills too.
Absolutely,
so.
As you should.
Yeah, so I get that. All right. Okay, that's actually really good information.
Oh, yeah.
I'm learning a lot here too.
Yeah.
And but I obviously won't qualify for a while. But are there any other pitfalls or anything to look out for? Is there any other advice that everyone should know?
Yeah.
Things that you're telling people every time you get on the phone with them?
There is so much more that you should know, but I'll
let's
tell you.
cover all of it in detail.
Yes. We'll start
Don't
writing a
leave
book.
anything
Somebody
out.
dictate. No, just get Siri out.
Madam
She can
Court
write the book
reporter?
for us. Yes. With Medicare, it's not 100%, right? There's going to be deductibles and things that you're going to have to pay.
You mean they don't cover everything?
They don't. Well, they cover a lot of medical things, but they don't, as far as the bill is concerned. Medicare, in generality,
when you say the bill,
is that a word? When I say the bill, I mean when you go to the doctor, when you go to the hospital.
Yeah. So to pay for the medical service.
Medicare is going to pay generally 80% of the bill, usually after deductible has been met. Okay, but 80.
Do you have to pay the deductible as the patient?
The patient, we call them a Medicare beneficiary. The member of Medicare has to pay the deductible. So Part A has a deductible and Part B has a deductible, and those numbers can change from year to year. The other thing too, and I should have mentioned this, is that everybody that qualifies for Medicare will receive in the mail a Medicare and You handbook. And all this information is in that handbook.
That sounds cozy.
Oh,
like
yeah, they're looking out for you.
Medicare
yeah,
and You. It sounds like a Berenstain Bears book.
Yeah, like, it's almost like a
just
blanket.
Me and my
just
Medicare.
Snugly and covered.
Yes.
No, it's called Medicare and You. It's such exciting material. If you want to read it, it'll put you to sleep at night. I mean, it's the best.
So it is cozy.
It's so cozy.
So people sleep with it. They fall asleep.
Nobody reads it. Nobody reads that book, and I wouldn't either.
Okay.
Except you should, because it's good information. But the bare bones of it is that Medicare really is an 80-20 split. Medicare pays the 80%. The other 20% then is the responsibility of the beneficiary or the member to pay, right? So then you need to think about, well, wait a second. 20% of a doctor visit, let's say I'm going to a doctor and the doctor charges $200. So that's a $40, basically coinsurance is what it's called, is a 20% coinsurance would equal out to about $40, right? Not so bad, but if you're going to the hospital and you have a $1 million bill, or just say a $100,000 bill, 20% of that, it could break your bank, right?
That's like, what, $20,000?
I think so.
Okay.
I'm not a mathematician.
Okay.
But somewhere around there, around those parts.
If we estimate.
Now, so then what you think is, okay, I need to get something, a supplement of some kind or some type of plan that will help me with that 20%. And there's really two roads that you can travel when it comes to your Medicare. You can use
The one less taken.
Medicare and the one most taken.
Yes.
No, there's the Medicare Supplement plans, which is essentially, it just picks up that 20% that Medicare doesn't pay.
Is this a federal program or is it private?
No, it's private.
Okay.
It's a private, offered by private insurance companies, considered traditional insurance, so there is underwriting involved in that.
So is it like traditional insurance, but 20% is big?
How do you mean that?
I mean, like
20%
they're only covering 20% of the bill.
Oh,
So is your premium
yes.
20% of what it normally would be, and everything's just kind of on a smaller scale?
Yes, I would say it's on a smaller scale. When you're comparing it to like individual plans, if you were under the age of 65, and premiums are,
Okay.
north of $600 a month, then
Okay.
these premiums are not so bad. They're scaled down. But when it comes to being on a fixed income, as most people that are retired are,
Mm-hmm.
and if that fixed income is small, then it can be quite a big expense.
Sure. Okay.
So, but I mean, you're somebody that's turning 65, they're brand new to this Medicare thing. Yeah, I don't want to give a specific number on here because it's specific to.
We'll save
every
that for the
situation.
phone call.
Yeah. But definitely call an agent like me, and we can get that set up for you. But a supplement picks up that 20% that Medicare doesn't pay. And it's a secondary insurance. So you have your Medicare card, you have a Medicare supplement insurance.
So you have lots of cards.
You do. You've got 2 cards. Well, and I'm about to add one more because Medicare,
So you
they
need to
make
get a bigger wallet when you retire.
Absolutely.
Okay. All right.
We're not talking minimalist wallet here. You don't want the Ridge or the Dango. You want the Seinfeld George Costanza explodes into the air when you try to close it.
All right. Okay. Write that down.
Yeah. Medicare makes it optional, but they really want you to be on a prescription drug plan. Even though you don't take prescription drugs, even though you're not planning on ever going into a pharmacy and getting prescriptions ever again and for the rest of your life, Medicare wants you to be on a drug plan. Okay, and that's really all they care about.
Is this one of those things where what Medicare wants, Medicare gets?
Yes.
Okay.
Yeah, because if you don't take one when you're eligible for one, they start charging you a penalty for not taking it when you were eligible for it. It's a nominal penalty. It's 1% of a national average premium for every month that you didn't have it. So let's say you turn 65 and then a year goes by, 12 months, and you say, okay, I'll get a drug plan. Colby says I need to get a drug plan. I'll go get one. Well, now you have a 12% penalty, which let's say the national average premium is $40. So
12% of $40.
yeah,
Okay.
is what your premium or your penalty would be. Is that a one-time penalty, you ask?
That's what I was about to ask.
No, it's a penalty that you pay every single month.
Oh, that gets added to your premium.
Yep.
Oh, no kidding.
So you want to get a drug plan even if you're not planning. Now, the nice thing about it is that there are options for plans that have little to no cost. Right. Okay. So, and then that's the second road, if the I'm getting ahead of myself. So there's a supplement and then there's a standalone prescription drug plan. So essentially 3 insurance cards you're going to be carrying: your Medicare, your supplement, and then a standalone prescription drug plan. The second road that you can travel is something called Medicare Advantage. Medicare Advantage
is this the third card?
No. Well, no. What it's going to do is it's going to take those 3 cards and it's going to mesh them into one card. Did you see that?
I didn't see how you did it.
I went from 3 to 1. I'm a magician.
That is amazing.
You didn't know I was a magician.
That's amazing.
What it does
you also know your wallets.
I do.
Yeah.
Well, I have the Dango. I just like it. I'm
right.
not endorsed. Get the Dango. Anyway, we're going to have to call them to give us a little bit of...
Yes, that's right. Otherwise, we're going to bleep it.
Yeah. So the Medicare Advantage comes in 3 flavors. I just like using these 3 things.
Yeah, that's cool.
HMO, which is a health maintenance organization, PPO, which is a preferred provider organization, and the last one is PFFS,
that's not what I was gonna guess.
which stands for private fee for service. If you think about Medicare is a fee for service plan.
Meaning
right?
I pay a fee my entire life through taxes?
But you also go into the doctor, they give you a service, and you pay a fee.
Okay, I got
So fee for service.
Okay.
PFFS is just private fee for service. It's the thing that most mimics what Medicare does, but it's a Medicare Advantage plan in the hands of a private insurance company. And all these private insurance companies offer these Medicare Advantage plans, and they offer them in varying benefits and copay structures and coinsurances and all of that. So you really need a licensed professional to kind of navigate this for you, because
That's kind of the vibe I'm getting. Is
well,
there's so much. I don't want to go try and figure this out.
yeah, you're not going to know what to look at.
Yeah.
Everybody confuses the terms deductible and copay. They
So
think,
dumb.
oh,
That's so
I go
dumb.
to the doctor and I have a deductible to pay. No, you have a copay to pay, or a coinsurance. Here's a good way to understand that. Coinsurance is usually a percentage, and a copay is a fixed rate, right? So if I go to the doctor and I have a $10 copay, I'm always going to pay $10 when I go to the doctor. If I go to the doctor and I'm going to pay 10%, that's a coinsurance, okay? So these HMOs, PPOs, and PFFS plans are Medicare Advantage plans, and what they do is they basically take the wheel of the car. I'm going to use an analogy here, right? If Medicare is driving the car, right? That's the card you have is Medicare. When you sign up with a Medicare Advantage plan with one of these big companies, they take the steering wheel, and Medicare doesn't get out of the car. You're not dropping Medicare by getting on a plan. Medicare sits in the back seat and pays the insurance company to offer you these benefits, to essentially take the risk of your health, okay? So when you sign up for a Medicare Advantage plan, you're going to save some money, but then they're going to put some added restrictions on there, like you have to work within a network of doctors. You have to receive referrals to go see specialists. That's an HMO. PPO, you have to work within a network. You don't necessarily need referrals. You can go out of the network if you want, but you're going to pay a higher cost, okay? So those are really the options, and those will help you save money every year.
Okay, so we've learned a lot.
Oh, yeah.
There's obviously we didn't get into all of it. There's a lot more to learn.
There's a lot more.
So here's here's my takeaway. Okay.
Okay.
I mean, I learned a few things, some great things, but I'm not going to go try and apply them myself.
You shouldn't.
My takeaway is when it comes time, I need to talk to Colby Baker.
You need to talk to Colby.
So if anyone else is getting that same vibe, and they wanted to reach out to you, and they had questions, first off, can anyone across the nation reach out to Colby Baker?
Yes. So usually an insurance representative like myself would have to be licensed in the state that you are residing in, and that's not hard to do. I have many contacts in other states, but then I'm also licensed in various states as well. So definitely reach out to me if you have questions. You can. My company is called Medicare Experts. My email, I'll just give my email.
Yeah, sure.
Yeah.
Great.
You can just reach me at Colby, that's COLBY, at cbmedicare.com.
And we'll throw that up on the screen.
Okay.
cbmedicare.com.
CB Medicare.
Colby at cbmedicare.com.
CB, B as in boy.
Yes. That's what I said.
Yeah. You got
CB.
it. Yeah.
And it'll be written, so.
Sure.
Yeah, CB.
Yeah. So yeah, reach out to me. I'm happy to answer your questions. Even if you're happy with the plan that you're with, you might be confused about maybe a benefit. I know all the benefits. I know all the plans.
It sounds like it. Awesome. Well, thank you so much.
Absolutely.
So we are going to, well, we're very grateful for the expertise that Colby has shared with us. We're going to have another video with Colby where we're going to kind of delve into a little bit of his past.
It's
and
murky.
We're going to find out more about Colby. But anyway, do you know our sign-off? Do you want to give our sign-off?
Absolutely.
Before you do,
Yes.
can you do it in an Obi-Wan Kenobi voice?
Oh yeah, we'll try. Let's see. May your fortune be with you always.
So awesome.